A recent report from the Canadian Institute for Health Information has some disappointing results on Canada's surgery backlogs. The study says that despite hospitals across Canada performing surgeries at close to pre-pandemic levels, it's not enough to overcome the backlog. The report says many patients are waiting 1 to 12 days longer for cancer surgeries, which the Canadian Cancer Society's Andrea Seal says is too long. And only about half of Canadians are reportedly getting knee and hip replacements within the recommended 6 months. The Institute's Tracy says staffing shortages are complicating efforts to reduce the backlog. Well, joining us to discuss the matter is Ms. Tracy Johnson herself. Ma'am, welcome to Forum Daily.
Thank you for having me.
So for some further perspective, can you tell us a little bit more about the overall state of the surgery backlog across Canada and whether some provinces are more affected than others?
So we at CIHI receive all the hospitalization data from across Canada. So what we can look at is what happened during the 30 months of the pandemic. So how many surgeries were performed compared to pre-pandemic. And from that look, we estimate that about 937,000 fewer surgeries were done across the country.
And what were found to be the most commonly delayed surgeries?
So the most commonly delayed surgeries are surgeries that we call scheduled surgeries. They are less urgent and less life-threatening. It doesn't mean it's not uncomfortable for patients, but an example of that would be surgeries like hip and knee replacements and cataracts.
So, how are these surgery delays potentially impacting the overall recovery chances and the health of the patients themselves? You mentioned hip and knee surgeries, but also what about delays for cancer treatment as well?
So we can see that cancer treatment like cardiac surgeries were the last to be stopped and the first to be begun during especially that initial stage of the pandemic when for public health reasons we had to shut down hospitals and keep folks apart. Those were the ones that were prioritized to the top. What we can see is that about 20% fewer were done. And right now, we see that there is, with some of the common surgeries like breast cancer and gut surgery, GI surgery, we can see that some of the wait times are 1 to 2 days longer. We don't have benchmarks for these, but it's reflective of the fact that the system overall is struggling to keep up. More concerning, probably, with cancer surgeries was the delay in diagnostics for a number of people, especially at the beginning of the pandemic. So, regular scans for cancer were stopped as well.
And on that note, can you tell us a little bit more about these delays to screenings for potentially life threatening cancers? Now, that was an ongoing pandemic concern, but how much of a delay are people experiencing when it comes to screenings amid all of this?
Well, screenings are right back to approximately, especially for about half of people who go for either a CT or an MRI scan. The wait times for those right now are somewhere in the range of, for MRIs, it's about 42 days, and it's about 2 weeks for CT scans. And that's about the same as it was prior to the pandemic. 2020 was the worst year for numbers of scans done. At the moment, most provinces are up doing as many, if not more, scans than they were before. So they're rapidly catching up on that. Some people are waiting longer, though, at that 90%, 10% of people were waiting a couple of weeks longer than they used to wait prior to the pandemic. So again, probably a backlog in some of those delays.
And we mentioned that you were talking a little bit about staffing being an issue. So, can you tell us a little bit more about the healthcare staffing crisis and how that's impacting this backlog in surgeries and screenings?
So in Canada, just like around the world, we have an aging health workforce, but we have an aging workforce all around, but health in particular has been aging. And after a very tough couple of years with COVID and people working flat out, there's been earlier exits from healthcare and from those professions, as well as the number of anticipated retirements that people were going to have. So it's put us in a particularly tough spot with health.
Tough spot indeed. Just a quick 45 seconds left here, but what is your organization suggesting to be done to address this backlog and the shortage of staff?
What we usually try and do is put the data out there so that provinces can look at it and try and improve from each other. I would say right now that the focus the federal government and the provinces have through the recent bilateral agreements on more funding for surgeries is a step in the right direction. There are also lots of new funding for health human resources, and there's lots of strategies being looked at across the country to try and increase the staff that we have in healthcare.
Right, lots to keep our eyes on, lots of developments. So thank you again for joining us today, Ms. Johnson. We hope to have you back on Forum Daily in the near future. Thank you again.
Thank you for having me.